What's it called when your spine looks like this? A severe angulation of the spine is called kyphosis, and we actually have an example of it here at the Bone Museum. This specimen that we have here has Pott's disease, also known as spinal tuberculosis, which is when the bacteria that causes tuberculosis invades the spine. The body launches an immune response to attack the tuberculosis, causing a granuloma, and this granuloma will then cause caseous necrosis, which is a form of tissue death that results in a cheese, soft-like appearance of the affected area. The vertebral body will then lose its integrity, and they'll start to cave in on themselves, causing this severe angulation, also known as a gibbous deformity. The body will then try to heal itself by forming fibroses and calcifications in the infected area. However, this will lead to spinal rigidity, pain, and loss of mobility. Starting from the bottom, we can see that the lumbar have their normal anatomy and display some arthritis. But as we move to this affected area, L3 to L1 have been completely fused over, where that caseous necrosis has calcified. So just to break that down, tuberculosis is an infection that typically affects the upper respiratory system. However, in very rare cases, it can spread to the spine. And this causes the spine to weaken, and it will eventually start to cave in on itself bit by bit over time. The body will try to correct this caving in, and it will harden and fuse the tissues in this area. And this is what we're seeing here. Tuberculosis only spreads to the musculoskeletal system in about 1% of cases. And of those 1% of cases, 50% of them occur within the spine. Fun fact, this is called Pott's disease because the first surgeon to identify it and write about it in the 18th century was Percival Pott. This piece we have at the Bone Museum is very important because although many people believe that tuberculosis is not as widespread as it once was, it's still the 13th leading cause of death worldwide. So it's important to remember how devastating this disease can actually be and spread awareness to help prevent and treat it. If you like this video, make sure to follow the Bone Museum for more educational content.